guys, welcome back to Nursing School TV. So in this video, I want to discuss with you what my first week of nursing school was like. So basically my program runs Monday through Thursday. We have lecture or theory on Monday and Thursday, and then clinicals or skills lab from Tuesday and Wednesday, pretty much all day, 8 hours those days. So this week was a really busy week, kind of eye-opening. It solidified some of my fears. It kind of made me realize, okay, maybe I can do this. Maybe this is something I can do. And I realize it's the first week, but our professors have said that the first 2 weeks are pretty much rampant. We're doing so much that it does seem to calm down a little bit. So that's kind of reassuring. So basically the first week, or Monday, the first day, we had our orientation / lecture. So basically we went into the classroom, we discussed kind of what was expected of us, what the objectives of the nursing program are going to be like, the grading system, kind of where we're going to the hospitals and such. And then after that we got into the lecture. And so mostly the lecture, basically as an RN, your job is to, the main thing I took away from it was critical thinking. Basically our job is not just doing a set of tasks, and just moving on and doing a lot. It's basically doing some of those tasks may lead up to assessment, which you're assessing the patient and you're trying to realize, okay, so they have a fever and their oxygen's a little low, so what's that indicative of? What is that going to lead to? What do I need to do as far as, should I put it, should I give fever reducing medicine? Or, do I need to adjust the patient because they're uncomfortable or stuff like that? So basically that was really kind of eye-opening. It's, most times when you think, of the nurses, you don't really think of the critical thinking aspect of it. You just think, oh, they're doing this for me. But really, in their mind, they're doing all sorts of stuff. They're thinking about it. They're assessing you. They're coming up with diagnoses for you. Excuse my dog. She's running through. So that was kind of day one of lecture. Day two, which was the first day of clinical, we went into our clinical lab. We kind of got familiarized with all sorts of stuff. We have dummies, mannequins for everything. We have a really cool, I'm so excited when we get to this. We have a really cool birthing mannequin that actually, it simulates a woman giving birth, where it actually has the opening of the vagina where it, dilates to 10 centimeters and stuff like that. So I'm really excited. I don't know when we're going to learn about that, but super exciting. So basically our first day we went in there and they gave us this nice little checkoff list. It's basically a skills checklist. It's 4 pages long, and basically what we do in our program is there's certain skills that we just basically have to be peer reviewed. And what that means is we just have our peers come, they watch us do the skill, they mark us off on the skill, we have another one come, mark us off on that skill too. And then we have some higher level skills as far as I think what the professors think is the most important. They also mark off, so you test with them. And then finally we have stuff that will actually go into the hospitals and have the nurses kind of review us and mark us off as well, kind of making sure we did that in real life situation. So what I've gathered from a lot of the skills we're doing is basically this first semester we are learning all of the stuff tied to what a CNA would be doing ultimately. So the very first thing we had to do was hand hygiene, which you think, oh, it's just washing my hands. I do this every day, multiple times a day. This should be easy. It's not. Well, it is, but it's not. In a sense, it's a little more to that. We were tested by our peers, and then we're tested by our professor. And like I said, you do it with your peers. It's all fun and games. You think you're doing it right, and then you go to the professor and you say, okay, let's do this. Well, with me, I know the way I cement it in and kind of let it sink in and kind of let my professor know that I realize what the objectives are, what the main point is, I talk it out. So like, for instance, you walk up to the sink, you're standing away from the sink, and I'm all verbalizing this out to her so she knows that I understand what exactly is expected of this skill. I put my hands, in the water, I keep them down at an angle, I move my watch up, I get my wrist, I scrub my hands, I interlock them. I'm doing it for a minimum of 15 to 30 seconds, and even just drying them, simply we're normally like this, but you got to think about it, and that's that critical thinking skill. You want to go clean to dirtiest. You don't want to go dirty to clean, because then you just, wasted your hand washing. So, you're basically verbalizing out everything, and, then it's like, pass, you're done. And so that's, like I said, it's kind of nerve-wracking because you're used to just washing your hands any old way and being done with it. So the great thing about my program is they assign us videos to watch on the skills before we do the skill actually in the lab. So we're kind of familiar with it. So we watch these videos. They're anywhere from 3 minutes to 16 minutes, depending on the skill. So we kind of get familiar with it, then we go into the skills lab, then we do the skill, and then we test on it in a sense. So the next thing we did on that first day was also vital signs. And, so we basically learned how to do body temp, which, is easy, just basic thermometer. Apical pulse, I don't know if you know that, that's down here. You're listening at the apex of the heart. Learning radial pulse. Also, we do BP, blood pressure, manually. So we're not hooking up to the machines and letting the machines read to us. We're actually doing it manually. And we do it through a 2-step method. I might make another video kind of discussing what that is. We'll see. And then we do respiratory rate and pulse oxygen. Basically, your pulse oximetry, how much oxygen is in your blood. So we do all that. We role play it, like from start to beginning, as far as, we walk into the room, introduce ourselves, let them know we're a student nurse, and that we're there to take their vital signs. And you basically walk through the whole thing. And that was a little nerve-wracking too. We did it with our peers, and then we have to do it with the instructor. And you have to be within certain ranges. So like the BP, the blood pressure, they had a 2-way stethoscope. So one went in my ear, one went in her ear, and then I held it up here and I listened, for the beats to come in to get the systolic and the diastolic. And you're nervous because you're like, did I catch it when she did? Did I catch it close enough? Did I, I totally missed it, and the stethoscope wasn't the best stethoscope. It's not like your own brand new. It's kind of used, and, so you hope and you pray that you do a good job. And ultimately, I think everybody in my class passed that day. It might have taken 1, 2, or 3 tries, but they all passed. So that was really neat. So we're as a group, there's 10 of us. We've gotten really close over the last week. It's been kind of amazing to watch, 10 people in our group alone just kind of connect and help each other out. And we're all willing to jump on the bed and say, I'll be your patient, or, and then we throw little catches in there, asking the patient, hey, how are you? Are you okay? And they'll throw, no, I'm in pain. And, that's a great time. Our instructor, she calls them teachable moments. She comes over and she says, okay, so what would you do? Critical thinking. What would you do if your patient did say this? Because if a patient says, oh, my stomach hurts, you're not just going to be like, oh, okay, great, your stomach hurts. No, you want to, imply the empathy, and be like, I'm sorry your stomach hurts. When did it start? Kind of that, back to that assessing, back to that diagnosis, back to, the nursing process, basically. So it's been really, really fun. Wednesday, we actually did all of like the bed bath and making a bed with a person in it, making a bed without a person in it. So the CNA work. And our group has a bunch of CNAs in it already, so they're kind of above the level at which, like me personally, I don't have any experience in healthcare at all. I come from a family of nurses, but me, I've never stepped foot in a hospital as a worker. So, you kind of look and go, oh man, these people have a jump on it. But honestly, they have a jump on us just for a little bit, because then they're all learning new stuff. So it's kind of neat to see the dynamics, and it's been really great that they've been able to share their on-the-job knowledge, like, well, we do it this way, but this really helps out. So that's something I think we're really lucky to have in our group. So as far as that, like I said, we did back rubs, bed baths, complete, partial. So we did do, actually, we have little mannequins for peri-care. That's cleaning the vaginal area or the penis area, and we have these cute little mannequins of just those areas. So it's really neat we can work on those. I did take some pictures. I'm hoping I can share some of them. I'm kind of debating back and forth whether I want to do that or not, just because I don't want to get in trouble with my program. So we'll see what I can add or not add. So that was pretty much all for the first 2 days and of clinical. And then today we had lecture, and that kind of went over the nursing process. You know, basically, this is what you do as a nurse, and this is how you kind of get to it, and this is how you're going to handle it. So all in all, it's been a really, really eye-opening week. It's been a great week. It's been a long week. But I'm really excited to see where this goes. And I have one more week at my school basically doing the clinical care. And then actually in the 3rd week of the semester, I start my geriatric rotation. So we will be working at a home with older people. So that'll be another interesting kind of tidbit I'd like to discuss with you guys when we get there. So if you guys have any questions or anything like that, shoot the questions down below. Anything you'd like me to discuss as far as this early in the program. I realize I'm a week in, so there isn't much to discuss as far as that. But if you have any questions or anything, you know, feel free to shoot me a question below, and I'll be happy to answer it. All right, guys, stay tuned for the next video.